When a tooth is lost, the bone and the gum start to shrink over time as there's nothing there to stimulate them. Dental implants provide this stimulation to the bone and therefore slow this process significantly. But what we have seen over the last few decades is that with time, even with dental implants, the bone does continue to shrink. This is most significant in the front area of your mouth, where the bone is narrower to start with, and of course the stakes are much higher in getting those aesthetics perfect. To address this issue, a technique was developed called partial extraction therapy. This procedure is where a tooth is sectioned in two and the majority of it is removed, but leaving a very thin shelf of the tooth against the bone in the front area of the mouth. This fragment is called a socket shield. It essentially works with our natural biology in fooling the body in thinking that the tooth is still there. It prevents any shrinkage over time and maintains that natural gum profile that is often lost with implant surgery. You can see here one of our patients. The difference is very clear. One implant was placed some time ago elsewhere without the partial extraction therapy technique. Although the implant is still very healthy and the tooth restoration in good condition, you can see the bone volume has collapsed. When you look at the implant placed next door, you can see the significant difference in gum and volume that has been maintained. At Durham Dental Implant Solutions, it is our mission to provide dental implant treatments that aren't just successful now, but will also stand up to the test of time.